Good evening. My name is Ashish Jha, and it is such an honor to be here with all of you at the Schwartz Compassionate Healthcare Dinner. The Schwartz Center, for over a quarter of a century, has been a leading light on bringing compassion and humanity to medicine and to healthcare. And that is what is so exciting about being here with you this evening. Before I talk about the moment that we are in and all of the ways that we need to be thinking about the role of caregivers in this pandemic, I want to take just a moment to remind us where we are. And we are in a difficult moment. I think it would be unfair to the situation we're in, the gravity of the situation we are in, to not acknowledge that in this, the worst pandemic of a century, the biggest health crisis of all of our lifetimes, more than 250,000 of our fellow Americans have passed away. More than 12 million people have been known to be infected. It's been devastating for our country. It's been devastating for the world. And it's hard not to begin that conversation without first talking about healthcare workers. Doctors, nurses, respiratory therapists, pharmacists, custodial staff of hospitals, who even in the darkest days of March and April, or these very difficult days right now, get up, come to work, do what is necessary to make sure that we are providing care for people. And that has always been, I think, at the core of the mission of physicians and nurses and other healthcare providers, is that every day we must strive to do better. That's one of the ways we express our compassion. One of the ways we express the art of medicine is by working to consistently do better. But while there have been these extraordinary gains over the last year in caring for people, I think it's also worth acknowledging some of the costs that have been borne by frontline healthcare workers. More than 1,700 have died taking care of people with COVID. That's an extraordinary cost to their families, to their communities, to all of us. Beyond that, thousands, if not tens of thousands, have gotten infected and sick taking care of people. It's been a very long pandemic already. Healthcare workers, doctors, nurses, others have been on the front lines for months dealing with this. And they came into this pandemic with high rates of burnout from an overly complex system with too much bureaucracy, too much paperwork, and not enough allowing people to really provide the kind of compassionate care they care about. So we are in a tough moment, and we are going to have to do two or three things. First, we're going to have a bit of a recovery phase where people can just get back to their lives, so feel safe when they go to the hospital. That's going to be a really important part. But I think we're going to want to envision a much different system, one that really does let doctors and nurses and clinicians in general be themselves, to provide care, to be less burdened by administrative waste and other types of demands on their time that make it harder for them to do the right thing. Again, I think there's an opportunity right now to redesign the healthcare system to allow for that to happen. I hope we seize that opportunity. Otherwise, we're going to have a very hard time maintaining the kind of compassionate, high-impact healthcare workforce that we have right now. And it reminds me that in all of the failures we've had, and we've had plenty of failures over the last 10 months, it reminds me that there is no problem that is too big for our country. There's no problem that's too big for humanity. But the essential ingredients of that is about collaboration. It's about worrying less who gets credit and worrying more about achieving our goals. And we've seen that not just with the vaccine. We have seen the way the public health and the medical community have come together. You know, as a physician who has spent most of his life in public health, there's often a tension between public health and clinical medicine. But not in this pandemic. In this pandemic, some of the leading public health voices have been physicians. And in this pandemic, some of the leading voices for the value of clinical medicine have been public health experts. And it is also another area where collaboration has led to clear science, clear communication, a clear emphasis on how it is that we keep people safe, and if they get infected, how we take care of them and help them get better. I am incredibly hopeful for the opportunities to really transform healthcare in 2021 and beyond. Look, the pandemic has been incredibly disruptive. It has changed almost every aspect of healthcare. The one thing that is very clear to me is that we do not have to go back to what healthcare looked like in 2019. Now, healthcare has been on a journey. There have been changes that had been happening before the pandemic. But the pandemic has accelerated many of them. From the ways we think about payment models and how we pay for healthcare, so that we're not paying for healthcare as a transaction in a piecemeal way, to what everybody does, the roles of doctors and nurses and pharmacists. I think it's all up for grabs. And if we don't act proactively, we will fall back on old patterns. But I think this is an opportunity to do things very, very differently. And given the energy I am seeing in the healthcare sector by physicians, by nurses, by other providers, by healthcare providers, I really do think there's a lot of interest in saying we don't want to go back to the old system. We want to build a new system. We want to build a new system that's much more patient-oriented, where payment models really promote and allow people to provide high-quality care that is compassionate and long-standing. Those are our opportunities, and I think we need to take them, and I really feel strongly that we will. You know, compassion is the heart of healthcare, because the one thing that brings all of us together, whether you are a radiologist or a nurse or a physical therapist or any other kind of a surgeon, like, why do we do this? Why do we show up? Yes, it's a paycheck. Yes, it helps pay the bills, but that's not what drives most of us. What drives most of us is the desire to care for patients, to help them get better. And the underlying motivation behind that is compassion. It's about caring. And it is the one constant in healthcare that ties us to our past. And I believe if places like the Schwartz Center continue to flourish, will tie us to our future. It is the one way that we can draw a line between a century of caregiving, even as all the technology has changed, even though so much of what we do has changed. That heart of medicine has not. And I think it is fundamental that we understand it and that we acknowledge it and that we help it flourish. But I think the key lessons out of this pandemic is that if we don't have trust in communities, if we don't have visibility into what is actually happening on the ground, we will once again in future health crises miss the fact that these things disproportionately will affect poor people. They will disproportionately affect communities of color. We've got to do a much better job of building those relationships. If we don't pay attention to the incredible cost that this pandemic has wreaked on the healthcare workforce, and that we have to repair the healthcare workforce not just by having more personal protective equipment, but by really ensuring that healthcare workers understand that as a country, we don't just applaud them at 7 p.m. in the evening. We actually make sure that the system is designed and set up so we can protect them, so they can do the job that they came and signed up for. That's going to be an essential part of moving forward. So this is a difficult moment, and I am thrilled that the Schwartz Center has once again been such an important voice in guiding the nation on what we must do. Remember the hard work we have in front of us. Remember that compassion and caring is what guides us. Science is just a tool that we use, but science is not the moral compass. It is the belief in each other and the belief in a common humanity that guides us. And that is why it's been such an honor to be a part of this, such an honor to be with all of you this evening. I wish you all a very safe and happy rest of 2020 and the holidays, and look forward to being able to spend time together in person when it is safe in 2021. Be well and stay safe. Thank you.